Okay, sweetie. You can just take a seat and I'll be with you in a minute, okay? Okay. Just finishing filling out this little bit of paperwork. So hang tight. Okay. Alright. How are you doing today, sweetheart? Oh. Oh dear, I see. Have you ever had a sty before? Okay, yeah. Well, they usually come back if you've had them before, so that makes sense. Looks like the beginning of an itty-bitty sty. Let me look a little closer. Hold on. Put this stuff down. Just make yourself comfortable. How's school going today? Yeah? Okay. So, what class were you just in? Oh, that's fun. Do you enjoy choir? Yeah? That's good. I always loved it too. What would you say your favorite subject is? Nice. Sure, you're a very, very bright student. Haven't seen you in here before, so you must keep out of trouble for the most part, eh? Yeah. Okay, well, I'm gonna take a closer look at your eye. So if you would just try not to blink too much, but I'm gonna pull your eye apart just a little bit, just a wee bit, so that I can get a better look, okay? Okay, sweetie. Okay. Yes. You have beautiful eyes. Okay. Yep. That's what I think it is. Well, it's nothing to be too worried about. You do have the beginnings of a little sty going on, I'm afraid. Yes. That's why it's good to always wash your hands before touching your eyes, because you get germs in there, and basically styes are little pimples on the edge of our eyes, so nothing to worry about, but I am going to help it feel a little bit better. Okay, it's a little sore, isn't it? Yeah, a little sore to the touch. Okay, so we're just gonna do a little bit of eye drops, and I'm gonna have a cotton ball ready for you, and it's gonna be easy peasy lemon squeezy. Well, you don't like that one. Okay. Okay, I'm gonna get a couple of cotton balls ready. Do you often get styes or any infections, pink eye, anything of the sort? Okay. Yeah, well, maybe it's just a little season you're going through. But I would just encourage you to always use Germ-X, use soap and water whenever you wash your hands, and especially after you get home from school, you want to wash your hands because germs are everywhere. Okay. Also, where did I put the eye drops? Got some eye drops as well for you. These are really soothing and will take a lot of that itchiness and that soreness away. Okay. And I'll also send a note home with you to your mom so that she can also use some eye drops on you and make sure that we get this healed and out of the way as quickly as possible. Okay? Good. You're sweet. Okay. Good. And another. One more. Good. Now keep your head back for me just a little bit, because I'm going to come in with a cotton ball. Good. You're a champ. Just tapping away any of the last little drips. Okay. I'm gonna do just one more drop because that was really good, but I think we could use just a little bit more. Just a touch. Okay. I think you can handle another drop. Okay, good. You are doing great. Oh, good. Okay, that's all we're gonna do. Get a fresh cotton ball for you. Keep your head back, just like that. Good. Come on. Remember to breathe. Good. You're okay. You're okay. Alright. Well, we're done with that part. How's your eye feeling now? Okay. Is the other one hurting too? No, it's just that one. Okay. You know, I don't know how long it's gonna be. Sometimes the styes can come and go in just a couple of days. Sometimes it takes a little bit longer, but if you put in the eye drops like I taught you, or I just showed you how, then you're gonna be just fine in a couple of days, I would think. Yeah. I can barely see it too. It's not noticeable at all. So don't worry about anyone thinking your appearance is funny. I can't even really tell. Okay. Is there anything else? Okay. How long have you had this headache? Since the morning. That's quite a long time. Well, can I feel your forehead? I don't think you have a fever. Do you have a sore throat at all? No? Okay, it's just a headache. Well, what I can do is get you some water, and then I'll ask you a couple more questions, and I'm sure we'll get your headache figured out. How's that sound? Okay, let me go get you a glass of water. Alright, I have some water for you. Would you like to take a sip? We'll just take a couple of sips, okay, honey? Okay. Good. Okay. And I'll set it right here for you. So while you're sipping on that, why don't you tell me, how often do you get headaches? Not very often. No, like once a week. Okay. When do you usually get the headache? When you're at school? Oh, okay. How about when you're home? Do you have a headache before you go to bed or before dinner time? Just at school, okay. Well, I'll tell you what. It's perfectly normal. You come to school every day and you have a lot of things to do, I'm sure. A lot of assignments, right? Yeah. So, the headache could just just be a part of all that. Just a little bit of stress and agitation. So I wouldn't worry too much about it, but if it continues on and if it gets worse, then make sure you come see me and we'll figure it out, okay? Alright, so let me just make a note to your mother so that she knows about your eye drops and everything. What is your mother's name? Okay. Thank you. Okay, and before you go, I'm going to very, very quickly just check you for lice. We do this once a season, as you may know, and it's getting about that time where they are wanting us to do it again, so you'll just hang tight for a couple more minutes while I do that. What class do you have next, Belle? Okay, I'll be sure to write you a pass for that class as well. Okay, but it should be really quick. This is going to be the note for your mom. I'll put it right here next to you so you don't forget it. And then remind me to write you another pass for your next bell. Okay. Okay, but now just going to put my gloves back on first of all. Have you ever been checked for lice before? No. Oh dear. Well, there's a first time for everything. I'm just going to be combing through your hair and looking through it very, very carefully. And if I see anything, then I will let you know. But I highly doubt that I'm going to see anything, so don't need to worry. You can just enjoy me playing with your hair for a little bit. Okay. So, I'm just going to start at the crown of your head real quick. You have beautiful hair. Well, I don't see anything so far. We're good. You have a very clean scalp, so there's not any dandruff or anything I see in there, but it's always good to be thorough. Get in there. Let's see. Behind the ears. Okay, I'm just gonna come around to you for a little bit. You're doing great. Almost done, sweetheart. I don't see anything. We are good. You never know. It's always good to double check. Okay, I need to write the pass for your next class. Okay, so this is for Math 108. Okay. There you go. I have your note for your mother and also for your next class, okay? Alright, how's that eye feeling? Better, good. Yep, so if you just keep applying those drops, it should be good in no time. Okay, how about your headache? A little better. Okay. Well, if you need anything else, you just come back and visit me, okay? Alright, sweetie. Have a good rest of your